Hi, I'm Gwen Darien, and I'm Executive Vice President for Patient Advocacy and Engagement at the National Patient Advocate Foundation and the Patient Advocate Foundation. And I also serve as an advisor, member of the advisory board for the Patient Advisory Board for the Trust Project for the ABIM Foundation. I am a three-time cancer survivor, and I have been working in patient advocacy for almost 24 years since my first diagnosis of cancer. And I will say that I actually came to patient advocacy because of an issue of trust. And it's really a matter of trust that drove me into patient advocacy. I was 35 years old. I was not feeling well. I was not feeling the way that a seemingly healthy 35-year-old woman should feel. And I knew something was desperately wrong with me. And like many women and many people who are diagnosed at a young age, my doctors dismissed it. They said, "You're healthy, there's nothing wrong with you." I was a woman, so they treated me with a little bit of sexism, shall we say. And my doctor didn't trust me. And it turns out he was wrong. And ultimately, I had a diagnosis of non-Hodgkin's lymphoma. And fortunately, I pushed and pushed and pushed because it could have been a much more serious diagnosis than it was in terms of the stage. And that really set me off on my journey around patient advocacy, which was that I was working in contemporary art, and I wasn't sure exactly what I wanted to do, but I knew that I wanted to take the experiences that I had and help ensure that people who came after me didn't have the same kind of experience that I did, and also help find a community of people with whom I could make change and affect change, primarily in the healthcare delivery system and how patients and their families and communities received care. And from the outset of my work, I really focused very much on health equity and justice, and a just and equitable health system, which is also the foundation of that is a matter of trust. But one of the things that has been a consistent theme for me is that we often talk about trust from the perspective of the patient. The patient has to trust the system. The patient has to trust her healthcare provider or her clinical team. But I always like to flip it on its head a little bit and say the system or the clinical team or the doctor has to trust the patient. And if you don't feel like you have the trust of your healthcare provider and that they don't listen to you attentively, carefully, that they don't know you, that they see you and just see something that they kind of make patterns, you're not going to get the care that you both need and deserve. So that's how I started out in patient advocacy. It was a matter of trust, and it was a matter of equity, and it was a matter of accessing the care that I knew that I needed.
Visit buildingtrust.org to learn more.